Welcome to Agorà, International Aesthetic Medicine Congress held in Milan. And we are here with the key opinion leader of this sector and Dr. Tingsong Lim. Dr. Tingsong Lim, you were present in the section Anatomical and Climatic Differences, Implications for Aesthetic Medicine Treatments. So, which are the data regarding anatomical comparison in the application of volumizing fillers between European and Asian patients? Which are the data?
Well, I think Asian skin and Caucasian skin is slightly different. For instance, Asians have a more inflammatory skin, it's heavier, there's a lot of connective tissues. Therefore, there are things that we need to be careful when we do Asian skin versus Caucasian skin. The other thing is the treatment protocols and the treatment outcome that we want to look for. So in terms of what you can do in Asians or what you can do in Caucasians is slightly different. For instance, Caucasians, if you do ablative lasers, it works very well. But if you're using Asian skin, they normally end up with a lot of PIH. Especially when you do surgical, sometimes you have to be careful because the wound healing for Asians are much slower and sometimes gives you a lot of scar tissues. So those are things that we have to take care of. And also Asian skin, I think the one thing that always is the target is to do tightening because of the heaviness of the soft tissue. So these are things that we discussed during this session where we're comparing Asian versus Caucasian and also how they age differently.
And which will be the next steps forward in the field of aesthetic medicine and surgery in this field?
Yeah, I think in terms of aesthetic medicine and surgery, we have seen the progression of what we call regenerative aesthetics, which is looking at regenerative medicine to help someone look better or younger. So what we are trying to do is to restore structures of, let it be face or body, skin structures, and also function. So when we talk about regenerative, it's all about regaining structure and function, and this has been a big thing because now we are looking into restoring the basic structure and function of our skin, our soft tissues, our bone, so that we not only look younger, but we also behave younger as well.
So please try to define briefly in one word, if possible, what you liked more in this Congress.
So Agorà always has been something very exciting and different to me because I see a lot of my good friends here. I see a lot of technologies which are really fascinating but not yet well known in the world. So there's a lot of opportunities here, and of course in this field you see a lot of really good experts coming, share ideas and also scientific findings, and I think this is a very scientific sort of conference that we all learn and get to share something and try to think about or have more innovative ideas out of this Congress.
So let us tell to the public in one word, sharing and networking are the best two important things of this Congress.
Yeah, exactly. So sharing and also networking is the key of this Agorà Congress.
So thank you very much for your answer and your kind patience and the collaboration. And thank you to all of you just for listening to us. Follow us for the next section.
Thank you.